Swan was transformed from this to this. We'll be talking to her in just a moment. But first, for those of you who are thinking about making your own swan-like transformation, here are 4 things you must know before heading under the knife. I just want to warn you that portions of this story contain some graphic material. Take a look. From the Swan to Extreme Makeover, we've all seen the life-changing results of plastic surgery on TV. It's had a huge impact. In the last 2 years, 32% more women have gone under the scalpel, expecting the kind of fantasy fix they see on TV every week.
You're talking about how editing these shows, they condense going from point A to point B. Point A, pre-op, point B, total healing phase. And they condense it in 2 or 3 minutes. Instills unrealistic expectations into patients. And a lot of these patients now feel that it's like going to a hairdresser.
Dr. Randal Haworth, a plastic surgeon from the Swan, says there are some important things you should know before heading to the doctor's office. Number 1, never try to make over your entire body at once.
Liposuction can be quite dangerous surgery. Same thing with tummy tucks, same thing with breast surgery. And oftentimes if that's all done in one go, it may look impressive, but it's really rolling the dice for the patient.
Number 2, be prepared for a long and painful process.
There was a lot of pain and bruising afterwards. Felt like I had been hit by a Mack truck. It took me about a good month and a half just to recover from the liposuction.
Number 3, come in with realistic expectations.
The classic thing that's being bantered about is I want a celebrity face. And the patient just doesn't have the canvas to do so. You're going to meet with angry patients and ultimately unhappy surgeons.
Number 4, don't expect surgery to solve all your problems.
And it's not going to change an unhappy marriage. It's not going to allow you to gain promotion necessarily.
And finally, remember, this is surgery we're talking about.
It is medicine, and it is invasive medicine. We are altering things, your flesh and blood, and there are risks involved in that.
And here he is from the Swan, the plastic surgeon himself, Dr. Randal Haworth. Welcome.
Thank you very much, Ryan.
Good to have you here. Ooh, some interesting stuff in that video, and we're going to bring her out and talk with her in just a second. But let's speak generally at first. What is the most common procedure in this country, what would you say?
The most common invasive procedure is liposuction. About 385,000 were performed last year in 2003. It's a big increase from last year each year.
What is the easiest for a patient to endure in terms of, thinking about the different things that you guys do on the Swan, for example?
Well, invasive procedures, eyelid tucks.
Yeah.
We start to see that in patients in the 30s. And then invasive or non-invasive procedures would be Botox.
And the most expensive thing out there?
Oh, probably the most expensive would be a facelift. And some of these girls, they've had the total Swan transformations have been anywhere between $25,000 to $100,000.
$100,000. That's incredible. Is it realistic, though, to really go through all of the things that these contestants are going through? I mean,
it is very realistic to do that. We do these procedures every day on these girls.
But this is a television show, and you look at the list of things that you do, which, as a viewer, seem to all happen back to back to back.
Right. Well, the one thing that that they didn't really show, which I really wanted them to say, is that some of these procedures were done in 2 separate surgical sessions separated by 2 or 3 weeks. And that is important to maintain a margin of safety for our patients.
Do you rehearse what you're going to say to these patients before they see you? I mean, what is it like at that moment when it's all happened and they get to see themselves for the first time? How do you make them feel comfortable?
Well, it has to come from the heart, and we have to go and really sort of connect with our patients. It starts before the actual surgery. It starts in the consultation. And then we have to take care of them. We're the captain of the ship, so to speak, right through the surgery, and then after surgery we have to continue that connection. Patients have to trust us, and we have to in turn trust our patients.
So it's a doctor, it's a friend. It's quite a process. We're going to meet the woman who put her life and looks in this doctor's hands right after the break. Stay with us.
In my early 20s, and it progressively got worse and worse. My looks prevent me from being happy.
Welcome back with the Swan surgeon, Randal Haworth. It is Seacrest here in Hollywood, and last night another Swan had quite an experience. She endured 10 procedures and was away from her family and friends for 3 months. Take a look.
The acne started in my early 20s, and it progressively got worse and worse. My looks prevent me from being happy.
In her quest for a beautiful outside, Andrea would need to look inside.
She needs to go deeper than her skin. Yeah.
After undergoing more than a dozen surgical transformations, Andrea was in overwhelming pain.
Every part of my body hurts.
Once fully recovered, she was eager to see the results.
Hey, Andrea. Are you ready?
Yes. Oh my God. Wow. Oh my God.
Here to show us the results and tell us her personal story, please welcome Andrea Morris, everybody. Have a seat, Andrea. Come on in. So the doctor says you've come a long way. It's been a while since you guys have seen each other. After seeing the new you and living with the new you for a while, what do you want to say to him?
Thank you for changing my life, and I am so happy that I put my complete trust into you because you did an awesome job.
Oh, thank you very much. I appreciate that.
Relative to some of the things that you've done in the past, how intense was this process with Andrea?
You know, the intensity is, all these transformations are very intense. Mm-hmm. And what I was most concerned with Andrea was her skin, because that's the hardest thing with acne scarring. Mm-hmm. And so I had to really instill in her that she needed to have realistic expectations of what we can do for her. And that's the hardest thing, these CO2 laser abrasions where we take off the outer layers of skin. It's a tough recovery. And I think you did great.
Thank you.
29 years old?
29.
So if she walked into your office and said, you know, I want to change who I am on the outside, would you have still recommended all the things that you had actually done for the television show?
It's important that patients come to me with their own particular concerns. And then a lot of times the patients will say, well, what else would you do, doctor? This is a once-in-a-lifetime opportunity.
Which is a tough question to answer, isn't it? What else would you do? I mean, you just say it's all about them, and then they put it off on you.
They sometimes do that, but sometimes, again, I have to be the captain of the ship aesthetically. Uh-huh. And some patients, they just sometimes can't really figure out what needs to harmonize with the rest of their facial features, so I'm here to guide them. And sometimes, though, if a patient comes to me and they just want liposuction of the arms, and they have a big nose, I think it's unethical for me to say, well, how about that nose? Because that may be a family trait for them that they don't want to change. And all of a sudden, I will abuse that doctor-patient relationship where all of a sudden I will start to instill an insecurity. Oh, my God, he says my nose is terrible, and so on and so forth. And that we don't want to do. But when a patient gives me carte blanche and says, what else would you suggest, doctor? It sort of gives me sort of, they want to hear it.
Mm-hmm. That moment we just saw on the videotape of you looking at yourself in the mirror, the big reveal for the first time. Describe what it felt like to see yourself after all of that pain.
You know, I was in complete shock at first. You know, I was very worried that my son was not going to recognize me. So when he finally did, you know, at the end, I was so relieved, and I knew it was going to be okay. You know, and of course I'm still getting used to the way I look every morning, you know. But I like it, you know.
You happy? In the context of the Swan, it comes down to decision time where somebody makes it into the pageant and somebody doesn't. How do you feel about not making it into the pageant?
You know, Belinda really wanted to go to the pageant, so I'm happy for her. And I am happy that I'm back home, and I'm fine with it. I already left with everything that I wanted, and, you know, so I'm happy.
Well, congratulations on your happiness. Thank you both for being here. Good to have you. The Swan Mondays on Fox. Coming up next, Alicia Keys performs live and not yet 18, and each worth more than $150 million. Mary Kate and Ashley Olsen. Be right back.